Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.
Welcome to St. Louis on the Air. I'm Sarah Fenske. Perhaps no one is more vulnerable to the coronavirus than seniors who live in nursing homes, as some tragic situations in Seattle showed us early on during the American pandemic. Once the virus gets a foothold in one, it can spread quickly and leave serious casualties. Here in St. Louis, there are already clusters of cases at some homes, and that's led to major anxiety for family members and staffers alike. So here to discuss where things stand is St. Louis Public Radio reporter Eli Chen. Her piece about this issue aired on our station recently, and you can also access the web version on our website. That's stlpublicradio.org. Eli Chen, welcome to our show.
Hi, Sarah. Thanks for having me.
So, Eli, I know you've become an expert in this in the last week or so. How real is the problem in local nursing homes right now?
It's getting more real by the day. In fact, I was getting more numbers about cases at area nursing homes this morning. And basically, there are two nursing homes in particular that I've been focused on, and that's Frontier Health and Rehabilitation in St. Charles. They reported that 3 of their residents have died due to complications of the coronavirus, and they're trying to confirm a 4th one as well, who had died overnight, but they're not sure about what exactly that resident died of. And then there's also Life Care Center in St. Louis, and they reported that 22 of the residents tested positive.
22, wow! So that's a big number there. Do we know with Frontier Health, where they've had these deaths, if they also have a large number of people who are suffering from it currently?
So all I know is what the numbers I've gotten from their spokesperson. I think that they're still waiting on a bunch of pending tests. They've gotten a few negative ones, but it's affected some of their staff as well. I want to say about Four of their staff are recovering at home, and they're also having to borrow workers from other nursing homes, which I think is really interesting because now those facilities will be understaffed as well.
Right. So what happens to these nursing homes when they're having staffing shortages, whether because people are ill or they're on loan somewhere else? Are they able to do the kind of work that they need to be doing?
Yeah, that's a good question, and I don't have the full answer to that because I've been trying to get an interview with the management at Frontier Health, and what I know is that they create a special wing for the patients they are treating at the nursing home, and these residents are isolated from the other residents, obviously, and they're trying to do what they can there. And a special wing that's something that's under the Centers for Medicare and Medicaid guidelines that, nursing homes do that. Although a doctor that I spoke to for my feature that aired earlier this week said that not every nursing home has, the capacity or the space to make such changes.
Okay, so that takes both a certain level of staffing as well as physical space to move people to. Is that the issue there?
Yeah, and staffing is a major part of this issue because, as you know, Sarah, nursing homes don't have the greatest reputation, and a lot of that has to do with the fact that a lot of them are understaffed, and staff are often not paid very well. And the Post-Dispatch actually did a good piece a couple of years ago about how nursing homes in Missouri and Illinois are understaffed. So, when you throw in a pandemic, that really, puts them to the test and, how much they can clamor resources to respond.
Boy, this is just such a tough situation. So what are you hearing from families who have loved ones in nursing homes? Are they getting anxious? I feel like I'm getting anxious just hearing you describe this. Are people freaking out right now?
I talked to a few people for my story, not as many as I would have liked. I spoke with Michael Allen, who some people know as an architecture professor over at Washington University, and his aunt is at Frontier Health, and he told me that she got tested for COVID-19 and thankfully tested negative for the virus. But, he's really anxious about it. And he told me that, he had been trying to advocate for taking her out of that nursing home because Frontier has had issues in the past. Mm-hmm. And so he's kind of hoping that this situation would, help his family have another conversation about, where his aunt should be living. And then I spoke to another resident. She was relatively less concerned. She had more confidence that the nursing, actually, it's an assisted living facility, which is slightly different from a nursing home. She seemed more confident in the facility's ability to do things, to take care of her father. But the thing is that her father has Alzheimer's disease, and I heard some conversations about people trying to talk to residents through the window, and frankly, almost everyone I talked to for this story had negative things to say about window talking.
In terms of the health risks?
Actually, it was more in terms of people like the woman I spoke to, whose father's Alzheimer's, because he's not capable of understanding what's happening, and he doesn't know how to use the phone anymore. So they can't really have the conversations that she would want to have with him. And so she sends him letters every week. And one of those letters is actually it's posted along with my story. But, with a lot of those residents who are experiencing, dementia, Alzheimer's disease, they don't know why, their family is hanging out by the window, trying to talk to them. It's confusing.
Oh, that makes a lot of sense. But I'm sure it's so hard. I mean, these facilities have been closed to visitors for weeks now. I imagine family members just feel like they don't even know what's going on inside.
Yeah, you have to place a lot of trust in nursing homes to do to care for these residents, and it's hard to think about, especially if you're not confident in that nursing home's ability to care for your loved ones. Mm-hmm. So I'm hearing a lot of words like, we're just trying to do the best we can. We're trying to use FaceTime and other technologies to connect with residents, but they're honestly they're probably having a hard time with all of this because, in order to prevent infection, you have to distance these residents, not only from their families, but also from, people generally, and especially their own friends, possibly at their facilities.
So you'd mentioned that one of the people you talked to was thinking, man, maybe they should get their loved one out of the particular nursing home they're in. What do the experts say about trying to uproot someone in the middle of this and have them move back home with you instead? Is that advised if people are concerned?
So I spoke to an activist at Voice, and they're a group that advocates for long-term care residents. They advise that families not do that, and there are several reasons for not taking a resident out of their home. Because one, there's no guarantee that resident will be allowed back in for whatever reason. And also, are you prepared to take that family member, back into your house? There probably was a strong reason why you put that family member into a nursing home to begin with, because you didn't have the time or the resources to help them. And you also have to consider the fact that you could also expose that family member to the virus in other ways.
That's a really good point. So these are just some tough issues, and I just feel for the family members dealing with this and the nursing home workers. What do you see as the biggest hurdle for nursing homes in the weeks ahead?
I think it's going to be staffing. Like I said, I talked to a couple of doctors about this, and there was one in particular, Dr. Charles Criselius at Barnes Jewish Hospital, who's been trying to develop plans for nursing homes affiliated with BJC. And he said, shortages are going to be expected for facilities that have positive cases. That's just what's going to happen. And there's not going to be many places to borrow from. So workers are just going to have to work more overtime. They're just going to have to work harder to deal with this. And staffing makes the biggest difference in having enough help to do everything. And they're having to do more to account for the fact that residents are, a lot of residents are being put into their own rooms, probably need more assistance, and, are likely to become more depressed because of all the isolation.
Okay, well, this is just a tough situation all around, and I think we'll continue to keep an eye on it as this develops. So, St. Louis Public Radio reporter Eli Chen, thank you so much for joining us today.
Thank you, Sarah.
And we do want to remind people, if you want to hear Eli's piece on this, it's terrific, and it's at stlpublicradio.org. You can play the audio or also read it if you prefer doing it that way. And in keeping with the topic of Eli's reporting, our producer Evie Hemphill called her own grandmother to check in on how she's doing. Her name is Jean. She's 98 years old and nearly blind, but she remains in good spirits so far with this crisis, even with some changes at her own care facility in Pittsburgh. Jean and Evie agreed to let us eavesdrop on part of their phone conversation earlier this week. Let's listen to what Jean had to say about how this pandemic compares to other big national challenges she's lived through, and that includes the Great Depression and World War II.
I don't ever remember a time when the whole world was affected as much as we are right now. Mm-hmm. I mean, there have been times when communities, I can remember a time when we had an infantile paralysis attack when I was growing up, and I remember quarantines then.
That was infantile paralysis, you said?
Yes.
Wow.
But that was only in a particular area at the time, but I don't ever remember anything that just affected the whole country like this. No, I don't.
Does it have a similar feeling at all to what you went through when you were a young adult in World War II?
I think the things that I remember as being the most difficult times for me growing up was during the Dust Bowl times, when it was so hard for people to see. I grew up in Kansas at that time when the weather was so dry and the people out there just didn't have anything hardly. And my family did not experience it because we were in eastern Kansas. Okay. And it was not so severe there, but the people in western Kansas had so very little lots of times. And the dust storms were so severe. I think that's what I remember as being the hardest times in my lifetime.
Yeah. Well, something else that's been just crossing my mind is just, not really crossing my mind, really on my mind a lot, is just feeling scared for you. And I wish I could be with you, and I'm still upset that I'm not going to get to see you in a few weeks when I was planning to be coming through. But I also want you to be safe, and I think part of me is just wishing there could have been a way to anticipate this and bring you to St. Louis, or see if Dad could bring you to Wyoming.
Oh, well, I'd love to have you here, but it's wonderful that we could talk over the phone.
That's a great point. Well, what do you find yourself thinking about right now?
Well, I guess, Evie, I'm just so thankful to be here where at this point I can't really do much for myself. I have to depend on other people to take care of me. And I'm just so thankful that we have the home here and that there are people who come in every day and take care of us. In fact, last night, the lady who came in to give me the medicine that I take every day, she said that she was working a double shift, which meant that she was working 16 hours. And I just thought, people are working hard these days to take care of us and to serve us, and I really appreciate that. And really, I'm not experiencing any difficulties at all, and I think how much this is just changing people's lives. And so I just have so much to be thankful for, and I just pray for people who are having to work hard, and so many people are just not working at this point.
Yeah, which is its own awful challenge. Yeah.
And I think of the little ones that are having to stay inside, and then I talked to Johanna the other day, and she said your mother was giving Johanna's children a piano lesson.
Yeah.
But
a virtual piano lesson?
Yeah. We live in an amazing world.
Yeah.
To think how life has changed. I grew up back when we could hardly hear on the telephone. I can remember when my folks used the telephone, and if they really needed to make a call that was an important call, they would go into town and talk from the central office because the connection on the farm was so poor that often they couldn't hear the other person.
Wow.
It's just to think that I've lived through all that, to think what people can do today, it's just unbelievable.
And that was 98-year-old Jean Hemphill talking with her granddaughter Evie, who's one of our producers, from a nursing home in Pittsburgh. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.